topics by unique experts. And today we are proud to have two speakers, two experts of mental health disorders who will guide us, who will bless us on the topic of Down syndrome. It's a unique topic. In North India, generally Ayurvedic doctors are not practicing much here, but we are really proud of our South Indian tradition of Ayurveda, that we are focusing on mental disorder in South in comparison to North. So we would like to welcome all the dignitaries, Dr. Parvatheedevy ji, Dr. Renu Rathi ji. Welcome, welcome, madam. Now, I would like to hand over the charge of moderation to respected Madan Thangavelu sir. Before that, I would like to welcome Dr. Jagdishwar ji, Dr. Agnihotri ji, Dr. Jayesh Thakkar ji. Namaskar sir, namaskar sir. So, today is a unique day for Down syndrome, and we will be traveling our experts again and again to have their blessings. And we are grateful to them, both Matra Shakti, to accept our invitation within very short notice. Thank you so much. Now Harish Verma ji from Canada, Toronto has joined. I welcome Dr. Harish Verma ji from Canada. Welcome sir. Madan sir, now stage is yours sir. Agnihotri ji, namaskar.
Sir, namaskar. Namaskar.
Pawan ji, namaskar. Agnihotri ji, namaskar.
Sir, namaskar, sir, namaskar.
Harish ji, namaskar. Doma ji, thank you. Pawan ji, thank you for bringing us together again on this very important day and on a very important theme. The frequency, now both the experts we have, I know Parvatheedevy ji for several years now from Kottakkal. We have met in many places, and I'm delighted to be meeting with Renu Rathi ji. Namaskar. Now, Renu Rathi ji comes to us from Wardha, and I was asking earlier before we started the program about Sevagram, very important for the nation. And for me, Sevagram is very special because when Gandhiji was there, they built one small hut for him. And that is still there. That small home that was built for Gandhiji is still there. And I feel whenever I look at that image of that space, I feel that is the ideal house that is for India, for anywhere in India, a very simple dwelling with a veranda on the four sides, etc. So this is in terms of Wardha. Thank you for joining us, Renuji from Wardha. Now, Down syndrome is, as we well know, predominant forms of Down syndrome comes from trisomy of one chromosome 21. And the incidence is very high. Unfortunate, it is very unfortunate that this incidence is very high in the community. I don't know about Maharashtra, I don't know about Kerala, what is the incidence, whether those statistics are available, but whenever a family has a child with the Downs, then there are some problems that comes with it. In developed countries, Downs children today can live up to 50, 60 years of age. And some of them can live a good life in society. Some of them need a lot of help. The problem is with many of them, they are susceptible to a lot of health conditions. And from simple colds and infections all the way to heart conditions, etc. There can be a lot of problems with them. So we are very fortunate that two senior people have joined us today, Renu ji from Wardha and Parvatheedevy from Kottakkal. So welcome both of you. I just want to say a little bit, I don't know about the Wardha institution, but Parvatheedevy comes to us from Kottakkal, which is, we say, like the Oxford and Cambridge, that is the home of Ayurveda. And Parvatheedevy is superintendent of a very well-established hospital there for mental health and mental conditions. And her experience, her clinical experience is very, very rich. And we have learned so many things from Parvatheedevy about management of very serious conditions, mental health conditions. So on this instance, we would love to learn from you also about how the ways in which you manage Downs, mental health, and epilepsy, and all those are sometimes connected with Downs children too. So with those few words, once again, I just want to thank Pavanji. The reason for this platform, as Pavanji says, it came about by the COVID problems, the negativity in society at that time when COVID happened. And he felt there was a need to bring the community together, which he has done very successfully. We are our 340th webinar today, which is a big feat. And what is coming through in our webinars is a force for integrating the diversity that is there in India and around the world. Ayurveda in India has developed in different parts of India in slightly different ways. Kerala, and particularly Kerala. Even within the small state of Kerala, there are diverse practices. The north of Kerala has some practice. The southern part of Kerala has some other practice. So this is the very nature of Ayurveda. For a lot of people, they find it very confusing. How come there can be so many different practices? And we have so much to learn about these things. And hopefully, as we progress into our discussions, we will learn today something about how Downs is managed in different parts of India. The other wonderful thing that is happening is how Pavanji is gathering people from different parts of the country, starting from the south all the way to the north, and for all the Ayush modalities. So we have Unani people, we have Siddha people who join us. So there are lessons we can learn from all of these people. So this is a platform where we are bringing together knowledge from around India. So with those few words, we hope that this is a long journey, as Pavanji keeps repeating, it's a long journey, and we hope we'll keep this going, but we hope to also get a lot of support from senior people like yourselves, Renuji and Parvatheedevy. I leave the floor to Pavanji to take it forward. Thank you.
Thank you very much, sir. Thank you very much. Without wasting time, I'm communicating my gratefulness to both speakers who have attended this, accepted this invitation within very short notice. Thank you very much. Now I would like to request Dr. Renu Bharat Rathi ji, Professor and Head of the Department of Kamar Bhratya, Mahatma Gandhi Ayurveda College, Hospital and Research Center, Salod, Wardha. Welcome, madam. Welcome. Now stage is yours. Please guide us.
Yeah. Namaste to everyone. Sri Saraswati Namaha, Dhanvantari Namaha. Now we all know that we are gathering here. We are celebrating Down Syndrome Awareness Day, and this year's theme is "We Decide." So the motto is to encourage their participation and not discrimination. So we know that there are so many challenges with such people, such children. So you can see here the theme, that different weird socks, and you can, frankly speaking, I have also wore the different colored socks to especially aware people, to society, to aware about Down syndrome. So my topic is role of Ayurveda in the management of Down syndrome. I hope the screen is visible. Shall I continue?
Please. Renuji, we can see it very clearly. Your voice is also very clear. Thank you.
Thank you. Our specific learning objectives are to know about cytogenetics, clinical features, associated anomalies, and general and Ayurveda management.
Kindly go for slideshow to maximize.
Yeah. Is it moving now?
Yes, it's moving. I don't know if Pavanji can see, but it's moving here, Renuji.
Okay.
It's moving, but if it is slideshow, it will be
okay.
maximized.
Now,
it's already,
Renuji,
yeah, I'm doing screen mode.
Thank you.
Yeah.
There we are. Thank you.
Down syndrome is the most common chromosomal abnormality among live-born infants with lifelong intellectual disability and developmental delays. And these are especially demonstrable chromosomal aberrations. The most common chromosomal disorders occurring with a frequency of 1s to 800 to 1s to 1000 units. The triplicacy, especially there are three types. One type is related to extra piece, that 21 chromosome is dealing with all cells. Then an extra piece of chromosome translocated to every cell is another type. And the third one is in a very few cells where only related with this triplicacy. That is, this problem is attached with only few cells, and that is called as mosaicism. So there are three different types, but commonly around 97%, 95 to 97% is the variety that contains all in each and every cell there is a triplicacy. Chromosomal or genetic material has been attached to each and every cell of the body. In most cases, the extra chromosome is from the mother, so associated increased prevalence with an increase in conception age. So we can easily comment on that as the age progresses, there is a high chances of getting Down syndrome. So as far as Ayurveda is concerned, we can it is not directly mentioned as a Down syndrome in our text, in our compendia, but we can correlate it with Adibala Pravrutta Vyadhi, because this Vyadhi's presence is before conception only, and we can also rename as, or as a synonymous, we can convey it as a Bijadushti-janya Vyadhi. That is, the term itself indicates that the prognosis is asadhya. Then Matruj Vyadhi, as we discussed that at most of the times from mothers, the chromosomal genetic material or mother has been going to pass on the this triplicacy. That's why this is also called as Matruja Vyadhi due to improper cell division during fertilization. And we can also conclude it as a Karmaj or Atmaj Vyadhi due to the fate of pre-birth deeds, that is Purva Karmaja Karma, Purva Janmakruta Karma. Also in Atulya Gotriya Adhyay, Charak has been commented on such Manas Vyadhis as a Manas Mandyam. As we all know that in Down syndrome particularly, there is a drastic intellectual disability. So we can rename it as a Manas Mandyam. In this pictorial depiction, you can see that each and every part of the body is affected with Down syndrome features. And here you can see the flat back of head, abnormal ears, which is low set particularly, many loops on fingertips or Simeon crease particularly, then special skin ridge patterns or abnormal pelvis, umbilical hernia, then intestinal blockage or megacolon or Hirschsprung disease, and diminished muscle tone, that is generalized hypotonia, and so many other features are there. That's why there is a utmost need to screen these babies, the children off and on, and they requires continuous care till life, because this is, we all know that this is a asadhya Vyadhi. It is not going to change the scenario, but they need especially quality care and recurrent follow-up to deal with, to prevent complications particularly. So talking about clinical features and the diagnosis making, as we all know that the typical features are there. That's why due to the external dysmorphism, that changes typically related with typical features are there. We can call it as a dysmorphism. So the diagnosis is very easy. That is Down syndrome, but still we can confirm it with the help of karyotyping. So in external dysmorphism, the head flat, occiput, microcephaly, delayed closure of fontanelles, nose is flat or depressed nasal bridge, flat faces, brachycephaly, low set ears. Then there is a hypotonia all over the body, that is generalized hypoplasia, delayed dental or delayed teething or speech problem, speech delay. Then short neck, especially cryptorchidism, that is hypoplasia of genitals, and micropenis. Also, there is a intellectual disability and generalized hypotonia with hyperextensible joints. So it is also related, associated with so many systemic disorders. In this picture, again, we can directly depict, there is a clear-cut depiction of sandal gap. You can see here in this picture, there is a gap between greater toe and next toe. So, and there is a presence of simian crease. So it is typical with Down syndrome babies. And with the help of these dysmorphic changes, as well as sandal gap and simian crease, we can directly make the diagnosis very easily. As we already discussed, there is a typical almond-shaped eyes with epicanthic folds, and particularly there is a poor moro reflex, and that's why we can confirm it with the help of directly checking with neuromuscular reflexes or poor moro reflex, and also typical dysmorphic features. As we also we can see here, we can appreciate the very typical dysmorphic changes again. So going forward, we can discuss with the different systemic wise changes and signs and symptoms associated with Down syndrome. So related with CNS, there is a mainly intellectual disability with IQ less, that is sub-level IQ, subnormal IQ between 20 to 70. And there are high chances to get Alzheimer's and hearing impairment. Regarding head and neck, there is a brush-filled spots, epicanthal folds, flat nasal bridge, and protruding tongue. Especially tongue is micrognathia is also there, and protruding tongue is also there. So we have to check hypothyroidism also to rule out, because many times it is seen that hypothyroidism is also going with this DS babies. So it is utmost needed to check hypothyroidism, to check simply thyroid profile or simply TSH, which is very, very essential. Then musculoskeletal problems like hypotonia, atlanto-axial instability. What is the term exactly atlanto-axial instability? It means there is a cervical vertebrae starting and the base of the skull. In this junction, there is a subluxation. So due to the subluxation, there will be a problem of neck pain, then headache, headache. Along with that, there is a irritability. So we have to fix the diagnosis with the help of base of the skull X-ray, and we can confirm the diagnosis, and we can relieve it with the help of traction and neck massage, mannavasti. There are so many measures we can take care of this condition. Then related to cardiac, there are so many chances of getting CHD, that is congenital heart disease, like BSD, ASD, PDA, tetralogy of Fallot, and that's why it's very mandatory to check 2D echo and the screening of what exactly defect is associated with Down syndrome babies. So related to gastrointestinal system, we can come across with duodenal atresia or stenosis. Then annular pancreas. Annual pancreas means there is a extra growth of pancreatic tissue, thereby which blocks the duodenal area and hampers its function. Then there is a tracheoesophageal fistula, high chances of getting Hirschsprung disease, and megacolon or omphalocele or imperforate anus. So there are, we have to rule out which problem is present and which problem is not. And the aim or motto is to prevent such complications in the future. Next is immunology, that is impaired cellular immunity is there, and that's why there is a high chances to get malignancies, particularly AML and ALL, that is acute lymphoblastic leukemia in childhood condition. And later endocrine, which is hypothyroidism, we have already discussed, hyper or hypothyroidism. Then type 1 diabetes mellitus, as well as infertility in males. Here you can appreciate the clear-cut depiction, pictorial depiction of IRES, particularly brush-filled spots. These are the grayish-brown spots, which are very typical in Down's babies. and these are due to the aggregation of connective tissue. Also, there is a clear depiction of these features again. Now coming to the investigations part, we can prevent this condition with the help of before preconceptional shodhan. We will come on this point after further slides. But before that, we can suggest them to abort, as there are so many tests like triple test, quadruple test in pregnancy. Up to the 10 to 14 weeks of pregnancy, we can check them and confirm that whether there is a chance of getting DS babies Down syndrome or not. And simple blood samples of triple test or quadruple test to confirm it. Also, amniocentesis or chorionic villi sampling are little bit invasive procedures, but they are confirmatory. But chances are there to get there are little bit chances to get abort due to these procedures. But there are non-invasive procedures too. So we can non-invasive investigations. We can confirm the diagnosis as well. Then postnatal, related to postnatal clinical diagnosis, mainly karyotyping, 2D echo, BERA. BERA is for brain evoked response audiometry. Then CRP to confirm any kind of infection, CBC, IgA, particularly to check whether there is a tissue transglutaminase antibodies presence or not. And these antibodies present in celiac diseases. And also there is a need to do IQ test, ophthalmic and ENT checkups. So here we can see that in triple test or quadruple test, there is a clear depiction of different chronological or other trisomy 18, that is Edward and Patau syndrome. There is a clear depiction that which which test, which result goes down and which is increases pregnancy associated plasma protein or AFP, that is proteins, or SCG. Particularly SCG is very high in Down syndrome, whereas in trisomy Edward and Patau particularly these are very much decreased. So we can confirm the diagnosis with the help of triple test or quadruple test. Here we can confirm it with the help of karyotyping also. As you can appreciate, these are the three triplication is depicted in the 21 number of chromosomes, and it is very clearly depicted that as this presence or triplication is present only in Down syndrome, so this is the Down syndrome confirmed by karyotyping. Next is we need to supervise these children with Down syndrome because they require so much care, and the motto is to avoid or prevent the complications. As we have discussed that there are high chances of getting congenital heart diseases with DS babies. So we need to do 2D echo to check whether which kind of CHD, that is congenital heart disease, is present in these babies. So there is a presence of complete atrioventricular septal defect as a 37%, then VSD in 31%, ASD 15%, partial anterioventricular septal defect 6%, TOF, that is tetralogy of Fallot 5%, PDA, that is patent dectus arteriosus 4%, and miscellaneous 2%. Here we will see one by one what is the motto or what is the necessity of screening. So we have discussed that in congenital heart diseases, we need to do 2D echo and confirm the risk or any emergent complication. So we need to check whether there is a presence of pulmonary hypertension or not, or related to cyanosis, or we have to check whether there is a urgent need of surgery or we can wait. So we have to decide it with the help of 2D echo. Related to strabismus or cataract or nystagmus, related to ophthalmic problems, we need to send or refer them to Ayurveda ophthalmologist or ophthalmologist to confirm the exact diagnosis, and their care must be enough to protect the further complications. hearing impairment or loss, particularly there are high chances, so we need to refer them for to be done BERA at the age of at birth or within 3 months of the age. We can send them for BERA, and related. The decision is to be at least important, because as we fix the hearing aid like cochlear implant or hearing aid, then their further speech delay or further cognition or learning disability can be prevented. So it is very important, if baby is not turning his head around to the hearing voice or any kind of sound, then it must be assumed that baby is at most needed to do BERA, to send to get BERA done. So here we can see the radiology image, X-ray image of duodenal atresia. These are two bubble sign, and it is a duodenal atresia. Also, it is a clear-cut depiction of annual pancreas we have discussed, CHDs we have discussed, and another problem is Hirschsprung disease, in which there is a sudden enlargement of colon, and due to that there is a constipation problem is there. So if the problem is very big, we need to do with the surgery, invasive process of surgical correction to be done, and refer to the child or pediatric surgeon or any related person. Then celiac diseases, we have to confirm it with the help of IgA and tissue transglutaminase antibodies. Then hematologic diseases, we have to confirm it with the help of CBC and related test to confirm whether there is a presence of ALL or CML or AML, any kind of malignancies, hematologic malignancies. Then presence of hypothyroidism with the help of thyroid profile, and there are special type of growth curves related to Down syndrome babies. So in each and every visit, we need to plot these curves to check whether there is a how much deviation of the growth and development. So it is very, very important that at which percentile the baby is relating or the baby is matching. So proper diet or proper exercise part, if baby is getting obese or overweight, then again we have to suggest accordingly the modified diet and lifestyle to avoid obesity or any further problems. Atlantoaxial subluxation or instability, particularly we can see with the help of skull X-ray. Then gynecological care, adolescent girls, especially menstruation related problems or getting contraception or conception, because there is a chances of getting infertility in these babies. So there are actually less chances to get fertile, but as the advances are there, so medical advances are there, so such adolescent girls or ladies can conceive. But again, there are chances of 50% babies to be born with DS, that is Down syndrome. So again, the thorough screening or these investigations which I have discussed earlier, we have to check. Again, if there is a sedentary lifestyle or overweight is there, there are chances of getting obstructive sleep apnea. So we need to, there are maybe complaints of snoring or restless sleep or sudden aerophagia or air hunger like problems. So it is a sleep apnea which indicates, and we have to treat it promptly to maintain the proper oxygenation level. Then we need to prevent recurrent infections, which are very much common, especially respiratory problems are so common in such Down's babies. So we need to check with the help of IgG or CRP or IgA levels. So we can give them Rasayana or immunomodulators drugs. So if talking with related with psychiatric problems or behavioral disorders, there are so much temper and tantrums due to these behavioral issues, and especially anxiety or depression, because they know that they are so much lacking related to study part or related to communication part. So they may suffer with depression, anxiety, and so much related issues like schizophrenia also or OCD. So we have to, in earlier condition, because the early diagnosis is very, very important, and we need to confirm the diagnosis as early as possible and intervene promptly to prevent further complications. So talking about complications, there are heart defects, GI defects, immune disorders, sleep apnea, obesity, spinal problems, malignancies, hematological malignancies, or dementia, Alzheimer-like conditions, and so many related to autism, ADHD, or seizures, ear or dental or vision problem, ophthalmic problems. There are so many problems associated with, already we have discussed. So we need to screen them time to time. We need to check their growth and development with the help of special curves we have discussed. I forgot to add in this slide. Otherwise, it would be good to add the particular growth chart in this slide only. But okay, you can directly see with the help of Google also. So coming to the management important part, there is no as such miraculous treatment to reverse the genetic abnormality that causes Down syndrome, because we have discussed that it is asadya shreni, asadya vyadhi. So we're not going to, we are helpless to treat it with the basic genetic abnormality, but we can improve their quality of life, their development, their life expectancy, and in a Ayurveda can do wonders. So we need to stick on it. Recurrent follow-up is mandatory, counseling is mandatory, and we can with the help of the holistic approach, we can make their health and as well as their life so much in that condition that they can live independently, they can earn, and they can live the life very with dignity. So we can discuss that there are so many therapies like psychotherapy, cognitive behavioral therapy, occupational therapy, play therapy. We'll discuss one by one. So first and foremost important, what is the role of Ayurveda? As there are so many important Ayurveda principles that Nidan Parivarjan. What is the Nidan here? The Nidan is marital or conception age should be reduced, or it must be within 30. The conception age particularly should be within 30. Nowadays, we can see that the age of marriage and age of conception is getting higher side, getting very much delayed due to the career, due to the qualifications, and there are so many expectations and job profile and like that. So we can see there are chances are increased due to this delay. So we need to avoid it, and we have to aware the people and society also. There is a important tool like samskar, especially we have to implement such samskaras at least 3 years of age. Then there are so many good Ayurveda principles of management like Deepan, Pachan, Rukshan, because these are very much important to maintain the gut flora as well as appetite, because such babies are initially they are very much sedentary, they are very much laxities there, they are reluctant to eat, and there are certain behavioral issues. So we need to tackle the things from Jatragni Pradipti, then Dhatvagni Pradipti, and in that manner we have to treat the Srotodushti also. So we need to give Vatalunuman drugs, Vatshaman drugs, Santarpan, Balya, Medya also. Then we need to boost their growth and development by Shaman and Bruhan with the help of internal medicines as well as external procedures. Then we need to boost or augment their motor function, because they are there is a it has been said seen that there is a global developmental delay. So we need to boost their augment their motor function as well as skill learning part, then to boost the IQ part and immunity. Immunity with the help of Medrasayan, Surana Prashan is a very good, awesome formulation in Ayurveda. Also, with the help of Chavanprash and Achar Rasan, we can improve their immunity. Again, Sattva Vajay is the important tool in which counseling or so many baby steps are there in Sattva Vajay, because it's a very big term. So there are so many steps to do and to deal with such babies, and we need to motivate them, very patiently deal them. tackle them, and positivity is at most important to allow them to motivate or to go further, and especially with the help of yogasanas, Surya Namaskar, Bandha, Mudra, Dhyan. These are so many tools or measures we can take help. Especially yoga is awesome, and it's a great tool, great thing to attach mana as well as sharir. The linking of mana, sharir and mana sanyuti, that will help to deal such babies. We can see here with the help of these Shalbhasan or Paschimottanasana or different Shankha Mudra or Pranayam, then Ujjayi Pranayam, breathing exercises, Purak, Kumbhak or Rechak, then Bhastrika, Shitali Kumbhak, then Jalandhar Bandha, there Dhyan, Mudra, Padmasan. There are so many important asanas, particularly Simhasan. You can see here it improves not only Gadgada Shredi, that is Mukatva or Gadgadatva or Minimitva, like speech delay is there, but with the help of it also improves the thyroid function. And these are so many asanas are there, important asanas there, thereby we can improve their motor function, especially we can improve their hypotonia. Also, acupuncture is important. We all know that it is a Chinese method, and there are certain points to boost their Urdhva Jatrukat function and brain function. So these are the acupressure points. But as far as Ayurveda is concerned, we can suggest them Marma therapy with the expert, skilled person who is knowing the Marma therapy. They can connect with them and get done the Marma therapy. Like below chin, then in between both eyebrows, then near the bregma part, then mid-occipital part, and at the base of the skull. So these are the important points in which there are certain marma like Adipati, Apana marma or Sapni marma, or there are these marmas are specially by pressing at a particular time. Now we can improve their function, brain function, as well as by stimulation their dushti or their we can improve the function. Also, color therapy is there because there are certain chakras, and the chakras have a particular color. So blue color is useful for stuttering or especially stammering or min gadatva. Related to associated problems, as we have discussed the GI problems, gastrointestinal malformations, we can deal with preconceptional shodhan, garbhini paricharya, then modified diet and lifestyle, kunjal as well as shankha prakshalan to prevent Hirschsprung disease or celiac diseases. Then related to dental problems or delayed teething, we have to rule out the other causes like hypothyroidism. Then regular checkups are so much mandatory, skinning is mandatory, and we have to check whether such babies are lacking with calcium, phosphorus, or vitamin D3 supplements. So we can supply if deficiency is there, we can supply it. Then ophthalmic problems, we can do such certain kriya kalpas procedures like tarpan, anjan, ashyotan, then trifla heme. With the help of earthen pot, we can put water and trifla churna in the earthen pot, and the upper part, the sediment, trifla powder will get sedimented, and the upper thin water part is called as heme, which is very useful for akshidhavan and eye exercises, tratak. It's very much useful to protect them, to prevent them for getting cataract or visual acuity problems and squint. Related to hearing defects, we can improve the conditions with the help of shaman and some certain procedures like karnapuran with the help of bilvatel or sarivadivati. Then mrudu vaman, if there is a utklesh of kapha, then we can suggest them mrudu vaman. But it is totally depend on the decision whether the baby having or a child having kaphot klesh or not. Then only we can do it. then Kapha treatment or Nasya Jalneti. There are so many measures, there are so many tools we can treat such babies with hearing defects. And the very important one is hearing aid, because it is not going to these procedures are just as an adjuvant. We need to apply proper hearing, we need to correct the hearing defect with the help of hearing aid only. Next is thyroid dysfunction. We know that thyroid hypothyroidism is so much common with DS babies. So here, early diagnosis is important. If baby is having, because in both the cases there is a generalized hypotonia, then constipation problem is there. So we need to rule out with the help of TSH. Then with the help of Madan, means to maintain the thyroxine tablet 25 mg or 12.5 mg, whatsoever the level of TSH, accordingly we need to give the dose of thyroxine hormone. And again, with the help of Ayurveda management, Vata Shaman or Kanchana Guglu or so many other measures, Shaman Aushadhis are there as adjuvant. We can give Jalandhar Mudra or Yogasanas or Shankha Mudra or modified diet and lifestyles are there. And collaboratively, we can deal with such problems, endocrine problems. Atlanta occipital subluxation, we already discussed that these problems is going to tackle with the help of neck exercises and traction or Manya Basti, importantly, along with Vata Shaman drugs. So physical growth is particularly tend to become obese with age, because initially they are very much lacking. They are delaying the growth is delayed, but later on muscle tone tends to improve with age, and whereas the rate of developmental progress slows with age. As age progresses, the developmental progress is slowed down. So we need to do Yukti Purvak Chikitsa and choose the proper procedure like Utsadan, Pindasvedan, then especially SSPS, Shashtikshari Pindasis is very much important to get rid of, to treat the laxity of muscles, hypotonia condition. So Nadi Swed exercises, aerobics, Zumba, we can engage them with the certain kinds of exercises as well as to learn the skill part and check them whether they are in which special ability they are having good good function. So we need to check them, and because that's why the MR, that is mental retardation term, is been ruled out and is been vanished nowadays. Now only we can say that they are in a specially able. So we need to identify in which ability they are good. Then next is malignancies, particularly ALL and AML, which is common in such conditions. So we need to boost the immunity with the help of immunomodulations, good nutritious diet, play, exercises, pranayam, and with the help of sadvrutta and so many other tools, satvavajay, so many measures are there we can add. Related to hypotonia, we can particularly deal with sadhan, abhyanga, nadisvedan, pindasved, parishek, or Tairadhara, because many times it has been said, seen that kapha is also avrutta is with the help of kapha is making avran on vata. That's why we need to do initially rukshan also, because vata and kapha both are dominance in such conditions. That's why we need to do rukshan also and bruhan also. So alternate rukshan bruhan is the logic we can do. And Annalepana, Udvartana, Nasya, Shiropichu or Talapoduchil, Shirobhanga, Basti, particularly very, very important as a Vata Shaman. Then Yogasanas, exercises, aerobics, physiotherapy, occupational therapy, and especially Shaman Aushadhis like Balya, Bruhan, Vata Shaman, Rasayan, and Medha Yoga are very much important, especially Vritapan. Related to speech delay, we have discussed that speech therapy is very much important. Tongue exercises are important. Swarna Samvardhan Bhuta, which is mentioned by Kashyapa. So these are the Mukha, Miniminitva or Gadatva, or in certain conditions we have to give Kritapana, which are having Medha as well as Rasayana property to deal with such conditions. So in Maharashtra particularly, Vedan procedure is so much popular. Vedan means what? There is with the help of 26 number needle, we have to just superficially prick the tongue on the all surfaces like interior, posterior, or periphery of the tongue or tip of the tongue. And the motto is to just stimulate the speech, not to pierce or not to take out the blood, but just superficially without any pressure, we have to just stimulate the tongue. So this is called as Vedan. And acupressure I have already discussed. Then counseling is very much important because such babies are getting inferiority complex due to that speech delay, because they are not easily communicate with their peers, their wards, or their peers, and particularly friends or family members. So we have to counsel them, their parents, how to deal with such delay, and continuous motivation is required, stimulation is required, and thereby they can slowly talk with at least they can whatever is necessary they can communicate. Dyslexia, which is a problem of reading, writing, or is especially related to getting education. The acceptance of problem is very much important, and ready to cope up mindset is required. So counseling or Sattva Vaje as a stress buster is needed. Then such babies are required so much bombarding, repeated with the help of tutor. The skill part or that reading, writing part should be repeatedly focused, repeatedly teach them, and they can get it. The thing is that we can improve on dyslexia with the help of repetition or bombarding. So there is the utmost security or love or patience is required, motivation is required. We have to give rewards, not directly rewards, but just making star or happy, a smiley. With the help of such beneficial rewards are very much beneficial. Then Medya Aushadhis, Gratapan, in all cognitive learning skills, and these Medya Rasayanas are very much important. And Ayurveda has blessed with so many Rasayanas, and we can make use of these Rasayanas, especially Medya Grita or Gritapan can be beneficial. And play therapy or learn with play, that is the important part. And also already in play therapy, clay therapy, different colors of clay, we can make them like burn. We can make the things to learn the things and accept the things. So these are repeatedly to be revised. Then related to stunting, because it's an important feature of Down syndrome. So the all over growth we have to boost, then only the stunting part will be reduced. So related Dipan, Pachan, Bruhan, so good nutritious protein diet, Vritapan, then especially some exercises are useful like Tadasanas or exercises, gym, or screening of other causes, hormonal endocrine insufficiencies like hypothyroidism or deficiency of growth hormone. Then acceptance and assurance, and deal accordingly and move forward. That is the basic rule. Next is immunomodulation, which is important to deal with recurrent respiratory tract infection as well as hematological malignancies. So Ayurveda is blessed with so many good drugs like Ashtavarga, Jivantadi or Purnadigan, Aushadhis, Ashwagandha, Yashti, Vidari, Shatavari. We have so many formulations like Churna, Gritapan, Asovarishta. There are so many formulations, and especially talking about Suvarna Kalpa, which are boosting the immunomodulation in a great extent, like Bhratva Chintamani, Kumar Kalyandas, Suvarna Passion, Yogendra Ras. These are doing wonders. So with the help of Suvarna Kalpa, along with herbal or mineral and metallic preparations, we can combine them, and as per our Vivek Buddhi, we have to choose the proper formulation and treat such babies. Rasayana therapy with proper compatible diet and timely Shodhan and Shaman medicines to prevent complications. Stimulation or rewards or peaceful environment is very much important. Then related to behavioral issue, especially don't deny the things, because parents are usually instruct the child that don't do this, don't do that, And again, that repeated denial mode irritates them. That's why they need to counsel that how to tackle such babies. Then avoid their triggers, which part is getting them very much irritating. The triggers should be avoided. And while denying the things, we have to explain the reason why parents are denying, and it is related to their betterment. Then only after the logic understanding, they can stop the thing doing. So again, some certain therapies are important, like hydrotherapy, aqua exercises, swimming, because their hypotonia is there. With the help of aqua exercises or swimming, their motor function get improved at a drastic level. So we can take help of so many other therapies, like clay therapy, related to their anger or related to temper tantrums or schizophrenia like condition. We can give balloon therapy, because their inner frustration should be removed, inner anger should be removed. With the help of balloons, they can puncture the balloon, and they can come out with their frustration and anger. So also cognitive behavioral therapy, that is CBT, is important. Then play therapy, music therapy, which makes them calm, and motivational bombarding, and particularly peaceful and spiritual environment and positive environment is very good to create positive vibes and to learn the things and skill parts and move ahead in the life with the help of whole system correction approach, which is very, very needed. Because only Ayurveda or only allopath or only one pathy is insufficient to do the wonders. But if we are taking help of related, especially occupational therapy and physiotherapy, are doing wonders, and especially yoga and Ayurveda are awesome. Dietary and lifestyle modifications, particularly DHEA containing food, almonds, walnuts, dates, sesame, nuts, protein diet are very much useful. And you all know Dincharya and Rutucharya, which is very, very important. Then Mridu Shodhan, time to time Mridu Shodhan, and especially no to Viruddhanna, Asatmanna, Apatyanna, Prakriti Doshaj Anna, Ahar. Then plastic or aluminum ware cooked food, then coated utensils, microwave cooked food, then fast food, junk food, soft drink. There are list is long, and nowadays we are so much habitual of taking such wrong diet, and which is increasing the mutation, or which is increasing the chances of getting genetic diseases or cancers. So we must stop and we must say no to such diet and such ahar. Then sedentary lifestyle is very much wrong, and poor parenting or poor care, because the parents generally come across with the mindset that these babies are not going to improve, so make another baby and forget it, and make the child live with his own condition. And this is very wrong attitude. We need to counsel them that parenting is the very much important thing to deal with such conditions, and it's not their fault, particularly child's fault to be with Down's baby. So we need to counsel them in this situation. So insecure environment, discrimination, or less love by family members, it is very much abusing them, very much disheartening them. So we need to counsel them not to do so. Here I am discussing in short my two cases, particularly one is a 1.5-year-old boy came to me with the complaint of global developmental delay. And there were so many problems like hyperactivity and saliva drooling, and he was not doing anything, and the speech was only bisyllable, only ma or ba or mama, like that. Then but with the help so many these interventions, as I have discussed earlier, so these with the help of this holistic approach, you can see here in this picture that also this PPT is attached with so many videos. You can see these if time permits, I'll play the video to get to understand this is the baby. He's playing holy and doing his taking his food with his own, then riding his tricycle, then brushing or bathing or every procedure or jumping. He's jumping, he's learning the things with the help of repetition. So he's doing wonders and he's so much improved. And the all credit goes to Ayurveda as well as multimodal approach. Another case is a 2 years old girl with DS Down syndrome and hypothyroidism. The problems are drooling of saliva since age of 6 months, then delayed speech since 7 to 8 months, then unable to sit, stand or walk without support since 1 year, and hypotonia since birth. And there was history of hyperbilirubinemia because that's why the baby was kept in NICU also. And related recurrent respiratory tract infections, lack of appetite, irregular bowel, and lethargic condition was the common symptoms. But you can see here the baby has been improved so much that she can dance, she can directly do her own activities, and there are so many drastic improvement you can appreciate in the videos particularly. And the common management in both the cases are Surna Prashan, Surna Kalpa like Bhratva Chintamani whenever needed, then Deepan Pachan Anuloman, Patashaman, Medha Rasayan, and speech stimulant, particularly Pratisaran with the help of Pacha, Ishtimadu, Kantakari, then Akar Karab. These are the herbs with the help of honey, Madhu. Pratisaran has been done, and which has due to these astringent properties as well as Surya Kantha effect, their speech problem was very much reduced, and they have reduced their dribbling, also stopped dribbling at completely, and their speech gets stimulated, and they can now able to speak small sentences also clearly. And again, Balya, Bruhan, Rasayan stimulant therapies has been given. And the most important thing is assurance and motivation, which do wonders. That's why this all holistic approach has been done. And especially procedures are Shiropichu, Shirodhara, Shirobhanga, Nasya, with the help of Shirabalatel 101, Sarvang Utsadan, Snehan, or SSPS, Udvartan, Patadhara, Matra Basti, and also different oils has been used, that Mahamash Tel, Bala Shivandadi Tel, Dashmula Tel, then occupational therapy, physiotherapy, speech therapy, play therapy, then counseling and Sattva Vajay Yoga. Of course, I have I have given so many interventions, but the motto is, it is not the results I cannot say that the result is of particular intervention, but it is a collaborative effect. And the motto is to just get the optimum relief, and the prevention of complication is the main motto, not to check the efficacy of a particular intervention. So in this detail, this is my article, and here I can I have mentioned this Shreya case to this article, and this is another article in which case report has been published. Then the mainly the take-home message is Down syndrome trisomy 21 is the most common autosomal trisomy and commonest identifiable cause of learning disability. Mainly, it has increased risk of CHDs and so many other abnormalities with a wide range of treatable medical problems. So the need of the hour is to check the screening and diagnose early and treat early. So these all can be treatable. So the need is to check the things time to time. Ayurveda being a life science, immense possibilities to improve quality of life, earn the livelihood, and live the life with dignity and independently. By using Ayurveda principles, prevention of these problems associated with it is the key of success in the management. Obviously, holistic and multidisciplinary approach is mandatory. Here, if time permits, I can play the video. You can see that child is playing. He's You can see here the baby is playing Holi. So the last slide. Thank you all for patient listening. And, any questions, I'll be happy to answer. Thank you all.
Thank you, madam. Thank you very much. Excellent. You have covered everything. Really, we are grateful to you. From both the speakers, I would like to request to guide us on 2nd April also for Autism Day. That is also related case. So please guide me. Please guide us on autism. That is also a unique topic. Madan sir.
Thank you, Pavanjit. Renuji, your presentation was so comprehensive. So
Thank you.
Extremely detailed, extremely valuable. First, I have put a few points down, notes, as I was listening to you. Number one is that you, by taking a difficult condition that is called asadhya, you have touched on all the aspects of Ayurveda that can be useful for even all of us, normal conditions. And the one message I have put from your last few slides is the need for a holistic, multidisciplinary, multimodal approach in future health and care, not only for Downs, but for all approaches. We need that system. And then you touched on some very difficult points like poor parenting and care. You know, that's a very difficult area, that especially autism that Pavanji talked about. There is, in a family with the autistic child, the whole family is disrupted, you know, and then to bring it back together that is very important. And you touched on a very nice concept of Prakriti dosha ahar. That is it's a very unique thing for Ayurveda that a lot of people, I mean, the condition Downs is found around the world. And there are many things everybody from around the world can learn from these kind of ideas, you know, the Prakriti dosha ahar and interaction with the gut microbiome, etc., is very important. Now, this issue of Swarnakalpa, we've been discussing this in our webinars, and interesting that you talked about that little point. And another very interesting one is acupuncture and marma chikitsa that you talked about. I will put in the chat box the journal of CCRA's Journal for Ayurveda Research has a book review of a new book on marma chikitsa. I will put that on the chat box. It's a very nice 400-page book that is come out now. And finally, of course, you have many other things, but this one I found very interesting, Vedana Karma. It seems very special to Maharashtra Parampara, because Rajanji, who is here with us from Mumbai, he has previously talked about the Vidhi Karma, the same procedure where you take a small needle and you release. I like this very much because the thinking is the skin as a target for treatment. The skin can be used as a target for treatment. And when we look at the cell biology of the skin, we find so many neurons there, you know. And this, it looks like, at first people say, well, what is there in the skin? Then when you look at all the neurons that are on the skin, the touch neurons, the heat neurons, the cold sensitive neurons, you suddenly see that the skin is a seat of a lot of the, what, for want of a better word, I'm going to say the vata aspects, you know. And you can use so many different modalities on the skin, including this of Vedan Karma. So thank you so much for giving all these wonderful details today. Your presentation has so many exciting details that we will all be learning about and we can learn from. As you well know, the presentation is recorded. It is available on the website if you want to direct your students to come and view the presentation. And people from around the world will also be visiting and viewing this. So thank you. Thank you very much from me. I don't know if you are staying with us for the rest of the program. If you are, then our viewers, listeners will have questions for you. So if you're staying with us, we'll be grateful. If you have to leave, you are in a hurry, then thank you again for presenting to us. Namaste ji. Pavanji.
Thank you, madam. Thank you, sir, and thank you, madam, both. Thank you, sir.
Pavanji, एक सवाल छोटा सा ये I think Renu ji is still here with us. Renu ji, could you tell us?
रहेंगी अपने साथ सर, पूरा प्रोग्राम रहेंगे.
अच्छा, चलो first.
Yes, sir. So now I would like to request very senior person, very senior dignitary of Ayurveda, Superintendent, Government Ayurveda Research Institute for Mental Diseases, Kottakkal, Dr. Parvatheedevy ji. Dr. Parvatheedevy, welcome, madam. Welcome. We would like to be blessed by you. We would like to learn from you regarding Down syndrome. And again, I am requesting humbly to you to please bless us on 2nd April also. Please. Welcome, madam. Welcome. He is associated with various projects. Very welcome, madam. Welcome.
Good evening. Good evening to all.
Good evening.
First of all, I would like to express my gratitude towards the organizers of this webinar, especially Dr. Pavan Kumar, for inviting me to this such a wonderful session. And I'm very happy to see Dr. Madan sir after a long time. I'm not going through the etiology and other details of Down syndrome, as the previous speaker described in a very clear and detailed manner about that. And because of the busy schedule in the March, and I couldn't prepare the PowerPoint presentation. I'm sorry for that. Now, I want to share some points about the treatment or the management of Down syndrome based on the experience of our hospital and a project. We are conducting a project named Pratiksha. Pratiksha is a comprehensive multidimensional approach to the disorders of mentally challenged children. We are conducting this project since 2017. Now we are conducting this project in 12 special schools and bud schools, where the students with intellectual disability, they are managing the students with intellectual disability, and almost 50% of these students, these children, were with Down syndrome. Most of the students were with Down syndrome, and other with the other students with the mental retardation, other children are also there. The BUDS schools are for children, and BUDS rehabilitation centers are there. These are running by local self LSGD, and this BUDS rehabilitation centers are for those with intellectual disability with more than 16 years of age, and other BUD schools are with children below 16 years. And for this project, we received the National Level Scotch Award for Innovative Projects in 2019 for this project Pratiksha. And this project, we are conducting this project under National Ayush Mission. Especially why we selected this project is then special children need adequate support to improve their quality of life. Lifestyle modification, corrections in food habits, etc., alone has proven to establish lots of changes in the mental health of such children. And Ayurveda has a comprehensive approach to deal different types of cognitive impairment and effective management strategies for social, behavioral, and especially gut-related issues of children with intellectual disability. There are many classical Ayurveda formulations which promotes intellectual ability and memory power in children. It has been proved. Considering these facts, we have effectively conducted the project Pratiksha. First, we started in 4 special schools in Malappuram district in the year 2018. So in the next stages of intervention, we scaled up the project, and now the project is running in 12 special schools of Malappuram district, in our district in Kerala. among nearly 610 children, and among them, among these 600 children, nearly 300 children were with Down syndrome. Even though these bud schools are meant for intellectually disabled children, the schools don't have any kind of medical intervention programs to address the psychological associated issues of these children. So we create this through the project Pradiksha, we create awareness among the patient, parents, and teachers of mentally challenged children in these schools, because the parents are suffering a lot, and teachers also, but the parents, their stress is very much. And first we are conducting classes to the parents, awareness classes to the parents, how to manage their children and how to control their own stress, because all the parents with this type of children, they are suffering a lot. The parents are complaining that they cannot travel in the bus. The others, the nearby people, they are looking or they are staring at them, and their children, they have this salivation, many associated symptoms were there, will be there. So they are very they feel very difficult to travel in the public transport also. So we are conducting classes to control their stress and how to manage their children like that. Among the children with intellectual disability, more than 50% of them were with Down syndrome as at all. Then let's go through the major mental health related concerns in persons with Down syndrome. The symptoms of Down syndrome vary from person to person. Depends upon the person, it will be different, and people with Down syndrome may have different problems at different times of their in their lives. More than 90% of the children with have some psychological issues. Mental retardation varied from mild to moderate, different types of mental retardation. Some even have special abilities after training and early interventions. How the patient, children with singing capacity for singing, for drawing, many different abilities also are there. And their IQ, usually IQ declines through the first 10 years of age, reaching a plateau in the adolescent and continues to adulthood. At least half of the children and adults with Down syndrome face a major mental health concern during their lifespan. Children and adults with multiple medical problems are also there. The previous speaker has described in detail about that. The most common mental health issues include general anxiety, repetitive and obsessive compulsive behaviors, oppositional, impulsive and inattentive behaviors, sleep-related difficulties, depression, autism spectrum conditions, and neuropsychological problems characterized by progressive loss of cognitive skills, then severe another behavioral problems, and this pattern of mental health problems in Down syndrome vary depending upon the age and developmental characteristics of the child or adult with Down syndrome. And these problems also varies among people or among children who can speak clearly or who can verbal problems and non-verbal problems. The aggressive behavior is more in children with Down syndrome with non-verbal problems, or no, with verbal problems. Who cannot speak clearly has more aggression, and people with more proper verbal communication, their aggression was less, and the anxiety and other depressive symptoms were more in children with verbal without any verbal problem like that. The non-verbal problem solving abilities, because they can express their issues, so the aggression was less, and it was more easy to communicate with the children, to the children with proper verbal communication. So the aggressive behavior was more in people with problems in verbal communication. And And in older age, the people with, not the children, the people with Down syndrome, in the older age, these problems were more. And the symptoms like dementia, the memory issues were more with people with Down syndrome. Or after nearly 40 years of age, they had symptoms like dementia. And the other outline of the project was first in phase 1, the assessment of the mentally challenged children. It was an assessment. First, we conducted awareness classes for the teachers and parents of mentally challenged children in the selected schools. Then we have selected the children from among the students of that special school. We selected the children for our project, and then case taking assessment of the psychiatric issues. There were different types of psychiatric issues, and after the proper assessment, the medicines were dispensed. Medicine have given to the selected children according to their symptoms, and according to the dosha predominance, symptoms were given. And we have provided IP treatment also. First, for all the children, we have given the OP medicines, outpatient. In the project, we have given internal medicines only. But if the symptoms were severe, and once we are thinking that they need some IP management, we have provided IP management in our hospital. And then after the first assessment was done after 5 months of intervention, and then if the student, the children, if they are needed more treatment, then continuous treatment were given. And then a final assessment and analysis after 1 year of intervention, final assessment and analysis were done. And while doing the assessment, in the behavior problem, some medical causes should be ruled out, because many of the children with Down syndrome, they had thyroid dysfunction and some hearing loss, and then visual disability. And these problems, many of them, for many of the children, this associated hearing loss and other problems was the cause of this aggression and other behavior. First, we had to rule out the physical issues in the children, and then in many of the children, these emotional disturbance were associated with these physical issues like thyroid dysfunction and other. And for some physical issues there, we have given the medicine for that also. And many of the children in the after the assessment, many of the children with with Down syndrome had generalized anxiety. Major part of the children had generalized anxiety. These are the most prominent presentation among children with Down syndrome. This manifests as an increased level of both baseline as well as situational anxiety, with clear-cut stressors for each. Situational anxiety is often manifest during the transition and anticipation of new situations. Transition from home to school, transit, meal or bedtime, as well as during new and unfamiliar situations. And then another major complaint was obsessive compulsive symptoms. Increased level of restlessness and worry may lead to children to behave in a very rigid manner, even resulting in a state of being stuck. It's often reported by caregivers, their bystanders or parents, where the child needs to follow a familiar routine in these situations. They also engage in repetitive, compulsive, as well as ritualistic behaviors. The child under these circumstances tend often to be always unhappy, fearful, and these two states, generalized anxiety and obsessive compulsive behaviors, may often coexist. And then depressive symptoms also were there. Symptoms of depression often present with extreme social withdrawal. and sadness and inability to enjoy many activities they used to love. In schools, we have conducted many group activities, and these children with depression, they were not cooperating with us. Disrupted sleep commonly occurs in both depression and anxiety. Sleep problems were there. A most remarkable aspect of depression in children and adults with Down syndrome is association with environment noxious triggers. This may include previously unrecognized medical illness. This medical illness also caused this depression, and then sudden chronic illness in their family members or sudden death of their family members, and their loss of a pet or their favorite things, and even the absence of a teacher, their favorite teacher, caused depression to these children. And then this inattentive, impulsive, hyperactive, and disruptive symptoms were there in many of the children with Down syndrome. Behavioral and emotional difficulties, this oppositional defiant disorder, that aggressive behavior were there, and mood disorder also. Mood disorder, sometimes these symptoms will be associated with their behavior. But some students or some people or some parents were telling that sudden mood changes, swings of mood were there for their children. This type of behaviors, problems, emotional issues were there. And among the aged people, or more than 30 years of age, they had Alzheimer's problems, problems with their memory. And some sexual perversions also we could identify, because they cannot understand, or they are not aware about these behaviors because of this intellectual disability of IQ, low IQ. They are not aware about what they are doing. This Viveka Buddhi was not there, so they are not aware. And epilepsy was a major problem. And many of the students had epilepsy. I think more than 40% of the children had epilepsy. And after this assessment, the intervention was done. And first we have done is after this awareness classes and everything. First we have done is the Krimishodhana and Deepanapachana medicine. Koshta Shuddhi was done. And for all the students, we have given the Krimighna Vadi for Krimi, and Ashtachurna syrup for Deepanapachana. We have given for 2 weeks. Then only we have started the other medicines. And depending upon the symptoms and the diagnosis, the internal medicines included Shankhapushpi Churna, then Saraswata Churna, then Vacha Churna and Yashti Churna. The combinations were different for different conditions, or depending upon the dosha predominance. And for aggressive behavior, the children with more Paitiga behavior, we have given Sarpagantha and Yashti Churna and Shweta Shankupushpi also. And depending upon the conditions, these combinations, many single drugs were there, like Shankupushpi, Vacha, Yashti, Gokshura, then Sarpagantha, then Ashwagandha, then Kushta. This type of powders were there, and different combinations we have given to conditions of different dosha predominance. Then Saraswata Churna, Kushmanda Swara, there were different gridas, Kushmanda Swara Sagritam, Tiktaka Grida, and Panjagavya, Mahat Panjagavya Grida, Kalyana Grida. This type of gridas were given. Then for if a child is showing more aggressive symptoms, and if we find it very difficult to manage in the OPD level, or to manage in the only with internal medicine, we advised IP management. And in the IP level, we have done all the panchakarmas, like first the preparatory procedure as Snehapana. Snehapana, we have given Tiktaka Kirda, Kalyanaka, and Panjagavya, Pushmanda Surasa Kirda, depending upon the dosha predominance. All these Gridas. The diagnosis was done, even though the patient is with Down syndrome, their symptoms was different. Paitika symptoms were there, and Vada and Mada symptoms were there. Depending upon the dosha predominance, we have selected the Grida, like Kalyanaka, Panjagavya, or Tiktaka, or Kushmanda Sarasa. And then after that, Virechana have done with mostly with Avipatti Churna. Many of the children were with Paitika symptoms. And then we have given Virechana with Avipatti Churna, and Yoga Vasti also we have done. And for Yoga Vasti and for Snehavasti, we have selected the Grida for indicated in that particular case. And some students, some children was very reluctant to take the medicines internally, take the Grida and other medicines internally. And in the IP level, inpatient level, we have given all the medicines as Matravasti. So the inhaled absorption was very good, and we have got wonderful result after doing the Vasti. The Vasti was very effective, and for some cases we have given only Matra Vasti, and other we have done Yoga Vasti also. And then other treatment like, and after that Nasya had done for Urdhvanga Shodhana. Different types of Nasya was done with Kshirabala, Anutaila, like that. And other Shamana procedures like Shirolepa, Shiropichu, and Dhara, different types of Dharas like Takradhara, Kashaya Dhara, to manage the associated symptoms. We have done this type of external procedures also. And after that, in the school itself, we have done some yoga therapies, mainly Sukshma Vyayamas. Some group therapies also we have done, group therapies and games to improve their socialization. This group therapies was were very effective. And many of the children have, not children, the people with Down syndrome had some this type of sexual perversions. So the Aragatha, we have given Aragatha Tattvakwatha. It was very effective to control their increased libido or sexual desires. And many and other therapies to other this group therapies and counseling to control the stress of their parents. We have to address their parents also, and many of the parents were complaining that their children have undergone many abuse and things like that, because they are not aware about the socialization is very less, and they cannot understand what is good or bad, what is bad. And then the parents were very stressed because of this condition of these children. And after doing this procedure, these medicines, the internal, the IP management needed only nearly 1 month. And then also they continued the OP medicines, outpatient treatment, and this internal medicine. We advise them to continue the internal medicine. And after this 10 months of treatment, their parents and teachers reported they got significant change in their irritability and their aggression and this restless behavior and hyperactivity. And mainly we got a good result in the to control the epileptic attacks, the seizures, and mainly in the post-ictal features. It was we got very wonderful results and significant changes noticed in behavioral domains. All these, in all these cases, we have done before treatment and after treatment. We have noted with proper scales of assessment in basic MR scale, corners, ADHD rating scale, different scales were used to assess the result of the treatment. And significant changes, we have noticed significant changes in the behavioral domains of basic MR scale, corners, ADHD rating scales, all this. And in this project, the innovative the new idea of the project was the parental stress were very well addressed. We could address. So the parents were also, and they could identify the abilities of their child. Many of the children had this, even with, they are with Down syndrome, they had some special abilities. And the parents, the relaxed parents can only identify their abilities of the child, and they could identify and they could interact their children more easily. After the training programs for the parents, they could interact more easily with their children. And diet modification was done. In this area, I think most of the people were taking non-vegetarian and junk food. And after controlling the diet, or after the diet modification, their the pachana was well, and then the digestion was very proper, and because of that only we could see some symptomatic changes. And social participation ensured. We have done all this with the help of their parents and teachers of the particular school. And special classroom exercise modules were prepared for these children for socialization and communication. Special exercises and some modules were prepared and implemented, and with appropriate medicinal intervention. And we have included local self-government, local bodies also in this project, because most of the bird school and birds rehabilitation centers were running by a local self-government department. And we have included the local self-government also. So their participation was also ensured. And this and the challenges faced in this this issue was mainly the parental education. The parental education, most of the parents were cooperating with us to do this project, and they but many of the parents were not educated properly, and with the poor economic status, and they are not aware about the education also. We are trying to call them, and many of them were sending their children to this bird school, and they are not taking care properly because of the poor socioeconomic status, and with the poor education, they are not aware about that. But many of the parents were cooperating with us, and they had very good results. And one another problem was the non-palatability of Ayurvedic medicines. As all of you know, the medicines are of bitter taste, and with the ghee medicine also, the children were not willing to take. And some of the medicines we have changed as tablet form, and we have given it. Then this non-palatability, they were complaining about this non-palatability of the Ayurvedic medicine. And for diet modification also, it was challenging to us, because almost all day, many of the people are taking non-vegetarian food and junk food, all this. And to control their food, at least in the time of the medication, to control their food is very difficult. The parents are also not willing, and the children also, they want to, other people in the family were taking other food, and they are willing to take that food. So it was very difficult to for the diet modification. Diet modification, it was very challenging to us. And the attitude of society towards special children, that with this awareness, and it takes time to change the attitude of the society. Now it has changed a lot, but I think it will take more time to change the attitude of the society towards this mentally challenged children. And this, as I told, the parental and teachers' education is most important. Is the most important of this thing to reduce stress in the parental education. And the outcome was substantial improvement in the signs and symptoms of the psychiatric disorders that were diagnosed in the students, the people with Down syndrome, and the improvement in the quality of life. That was a major thing, improvement in the quality of life there. This salivation doubling of it was cleared, and their quality of life was improved mainly. And now I think the new age with improved assessment of mental health concern. Now we are the assessment of mental health concern in children and adults has improved considerably in recent years. There is now a wider range of available screening and diagnostic tools for assessment of mental conditions across different developmental age groups in terms of measurement of domains such as nonverbal problem solving abilities, language and communication, and adaptive and behavioral functioning. There are different types of scales. Much of our current knowledge is based on clinical experience, and although emphasis varies depending on the orientation of each provider, behavioral modification, what is needed that we could do. After now the project is continuing in these schools, and we are getting very, very wonderful results in the management of this Down syndrome or the associated symptoms of Down syndrome. And we want to scale up the project into other districts of Kerala, also into some other districts, and with the collaboration of NIMHANS, we are trying the collaboration of NIMHANS also to continue the projects in other areas of Kerala. This is related with our project only, and IP management also. Apart from the students of this or people with Down syndrome in this project, we are doing treatment to other people or other people coming to our hospital. The treatment is almost the same protocol. I think I'm concluding by this. If there is any question, I can answer more. Okay, thank you all. Thank you,
madam. Thank you very much. Thank you very much. Without presentation also, you have covered everything. Everything. Your clinical experiences, practical experiences, these are the real blessings for us. And again, I am again humbly requesting to bless us on 2nd April, where Dr. Karthikeyan will be there, where Dr. Prasad will be there. Both are agreed, and Dr. Tahir will be there. So I am requesting Dr. Parvati again to bless us on autism, on World Autism Day, 2nd April. Madan sir. Kamini Diwanji bhi, namaskar. Kamini ji, namaskar.
Parvati ji, namaskar.
Namaskar.
Namaskar. Thank you so much for your wonderful, as Pavanji says, you've managed to touch on all the aspects, particularly the Pratiksha aspects, and now the BUDS rehabilitations. And I've put in the details, Parvatiji, of the BUDS institution, Kudumbashree's institution. Yeah. The Kudumbashree is a very, very important initiative. I don't know if there are similar initiatives in other states of India, Kudumbashree initiative, and this is wonderful to see. I hope I put the correct web link for BUDS Rehabilitation Center. The one that I want to put here, I'm going to put this link here for Pratiksha, but you have to correct me if this is the correct, if I'm putting the right link here. Pratiksha is, I could find one website here, special school for children who suffer from intellectual disabilities and hearing impairments. I don't know if this is the same in Malappuram district also. A question for both yourself and Renuji, a point that came through was about Prakriti assessment. Now, how easy is it to do Prakriti assessment in Down's children? Because you are doing, having understood the Prakriti, you are then modulating your treatment to match the Prakriti. Is it easy to do a Prakriti assessment in Down's children who already have some dysmorphology? Is it easy to do this? Because so it's a question both for yourself and also Renuji. I don't know how you do it in Kerala and also in Maharashtra. Yes, please.
Depending upon the symptoms, not the Prakriti, we have to assess the Vikriti because the disease condition.
Yes, okay.
Then we can clearly assess the dosha predominance in their in these children.
In the children.
Their signs and symptoms.
You can manage the treatment. Okay, thank you. The other very important point that came through in your presentation, and also some details are there in the Kudumbashree website, is about the perception, that community still thinks that these are, the community still finds it difficult to adjust to these children. And what you are doing is helping dilute that difficulty in the community, And as you say correctly, these are things that will take time to change. The other, I also liked your point about Basti as a procedure for your treatment, your main treatment. Could you tell us a little more about how easy it is to do Basti even in small children? It's a difficulty, but how do you do it in children with these disabilities? Is it easy to manage?
Yeah, children with more than 10 years of age, we are doing Basti, Matra Basti in a small dose. As these medicines are very bitter, many of the children are not willing to take. But after making them relaxed, then we are doing Basti. Basti is not much difficult.
Not difficult.
After making a good rapport with them, we can do Basti.
Well, this is the clinical experience, because you have so many decades of clinical experience, and this is very important. I have a question.
In other psychiatric cases also, in some catatonic cases also, if they are not willing to take the medicine internally, then we can do as Basti.
I know you make it sound very easy. We have talked before about the psychiatric conditions, and you say it is very easy to do all these things. But I know I haven't visited Malappuram. I haven't seen how you do it. But I take your word that you somehow seem to, your clinical expertise and skill is such that you get, you say it is easy. And, anyway, these are things, there are many things that we can learn from your experience. The last thing I want to say is how you have, a very important point that you've said about how the parents, when they are relaxed, they can identify some special abilities in the children, and that becomes an anchor point for interacting with the child. And then a new world opens up where it is so wonderful what you said about making the parents a bit relaxed about it and to point them to see this as a special ability. Every child has an ability. Could you tell us, our audience here, a little more about the Kudumbashree activities, because it's something very, very special in Kerala, the Kudumbashree activities. I don't know if there is a similar activity in other parts of India. The reason why I asked this, Parvatheedevy, is because when we look outside India, then there are many initiatives which are like the Kudumbashree initiative, which is run by the mothers or the women of the family. Yeah. And there are so many activities. And I just want to hear how it has evolved in Kerala and how you take on so many difficult projects. Are there other health projects like this? Because this is children with disabilities is a big problem. It's a big challenge.
Yeah, the women are more powerful after this this Kudumbashri works.
Initiative.
And they are doing lots of things like agriculture. They are cultivating many vegetables and things, and they are running many hotels, and they are running many shops. Many different types of activities are there. And women became more powerful, and they identified their own
Strengths.
abilities in this.
I have put the website. Yes, I put the Kudumbashri website here. Yes, for people to visit and to learn a little more. Now, Parvatheedevy, could you confirm if the Pratiksha, the special school, whether it's the correct website or not? I don't know if that is.
No, I think it's not.
It's a different one.
Disabilities and hearing impairment. That's not the.
That's not your Pratiksha. I don't know if you have a website or a resource for it, but I leave it there. And if we can, it will be lovely for us to learn a little more about Pratiksha. Pavanji mentioned the name of Dr. Karthikeyan, he's a modern medicine doctor and ENT surgeon, but his special passion is autism. And he runs a special center in Chennai, in Tamil Nadu, using Siddha medicine approaches for management of autism. So Pavanji is already connected with Dr. So Pavanji, from my side, I am so happy. I just wanted from Renuji, if Renuji is still here with us.
Renuji,
yes.
Kaminiji is with us, sir. So we would
Kaminiji,
like to
namaskar.
From Kaminiji also. Welcome, Kaminiji.
Namaskar,
welcome.
namaskar, sir.
Kaminiji, namaskar.
Namaskar.
Thank you so much for joining us today.
I have to say something, sir.
Please,
Yes,
please.
welcome.
Please.
No, actually, we are dealing with female patients, so we are working on preventive aspect only. And treatment of Dr. Renu mentioned is very good, but I was having question that she mentioned about music therapy. So which type of music they are giving to those are using for the treatment of Down syndrome? That was my query, or my I wanted to know that which lot many rag and lot many musics are there. So which music is beneficial for those kids? That is important. I think we should know.
Kaminiji, this question is for Renuji, but I don't know if she is here with us because she has some network problem. I don't know, maybe Parvatheedevy can answer this question also.
She can ask. She can answer if they are doing, then.
We are not doing the music therapy, but at the time of Dhara and other treatment procedure, we are playing some mild musics with instruments like violin or veena, and very, very calm music. That only. We are not doing a special music therapy procedure.
Yeah, madam, that relaxing music we use in every patient, no? But in specifically in Down syndrome, if any music they are using, then it is very much beneficial for those kids, I think. So,
I don't know.
Yeah.
Kaminiji, your question is very important and we have made a note of it. And I think we will ask when we will get an answer to you from Renuji.
Yeah, okay, so thank you, sir.
Now, I have a question in return, Kaminiji. Now, you are based in Gujarat, if I am correct?
So I'm nowadays in Delhi, All India.
In Delhi, in all.
Yeah.
Kaminiji, the question is, how is Downs managed in the northern part? So going from Rajasthan, Gujarat into Delhi.
Yes, sir. I have actually done work in even Himachal, even Gujarat, even Delhi. And incidence, I have seen that previously, before prior 15-20 years, incidence was much more prevalent in females. But nowadays, due to that level 2 screening, we are knowing that patient is having some abnormality or some defect. So that is, I think that is the reason that we are not having now kids who are having Down syndrome in recent years. Previously, we were having many kids like that. That is the thing.
Thank you. Kaminiji, the other question is, there are many practices that people in Kottakkal, for instance, where Parvatheedevy ji is, they have evolved over the many decades, you see, and they have some very special approaches for management of complicated conditions. And I don't know how we can bring it out of Kerala into other parts of India. Is there something that we can do collectively as an initiative, particularly in difficult conditions like this? Is there something we can think about?
So nowadays Kerala practice is all over in practice due to this PG scholars and PhD scholars. In our institute also, many students are from Kerala, and because of those students, we are giving thesis topic which is prevalent there. That I have also given thesis upon this cervical cancer topic that she was giving in Kerala. That yes, local things we have started to give as research project. So in this way we can transmit knowledge from north to south or south to north. If we are doing research in north and students are here from Kerala, we can give them topic, and
Wonderful,
like that our northern people can have benefit of those remedies.
I know it sounds very strange when we talk about practice that have evolved in the south of India, Kerala, Karnataka, Andhra Pradesh, Telangana, and then when we look at some practices in the northern part or the eastern part, it's very, very different. The other thing is there are many practices that I feel, together with all the Institute Ayurveda, Kottakkal, and places with Uttarakhand Ayurveda University, and also in Kurukshetra, I think we can put together, and NIA in Jaipur, we can put together some very, very impressive programs.
Yes, sir. In that case, multicentric study can be done.
Also, Kaminiji, also some simple procedures, this Prakriti assessment, etc., for other parts of the world, for people in Europe to understand, or people in America or South America, North America to understand what we have in Ayurveda. And it'll be lovely to have your guidance and help just to take some very simple interventions, dietary interventions, and how you understand, how you match diet to Prakriti, etc. Anyway, this was just a few thoughts from me. We will continue discussions on this, especially on the Autism Day. We will come back. We'll get an opportunity to touch some of these points again on 2nd April. So with those few words, I think Harish Verma ji might have
Harish
some
Verma ji, sir.
Harish ji, namaskar.
जी सर नमस्कार, सभी आचार्यों को प्रणाम। आज का सेशन बहुत अच्छा था, very informative. So Dr. Parvati ji, there is a question for you, because both of the speakers, they talked much about management of Down syndrome symptomatically with various Ayurvedic therapies and herbs and medicines. Now the point is, it's a genetic disorder. We call it, it's a karmas vyadhi. So can we incorporate Dev Vyapashara Chikitsa mentioned in Charak Samhita along with all the Sanshaman and Sanshodhan Chikitsa?
Yeah, we cannot treat the Down syndrome. We cannot cure the Down syndrome. We are treating the associated symptoms. Depending upon the associated.
What is the importance of Dev Vyapashara Chikitsa mentioned in Charak Samhita?
Deva Vyapashara Chikitsa. That if they are in an institutional level, we cannot do Deva Vyapashara Chikitsa. It's a very sensitive matter, and especially in Kerala, we cannot do Deva Vyapashara in the institutional level.
Why we can't do? It's mentioned in Samhita.
What in the among the people, if they are believing in one religion or one God, then if they are willing to do, we let them continue their practice. That only. Otherwise, it's a in Kerala, it's a very big issue, and we cannot do it in an institutional level. this Vipassana
I
Chikitsa,
think,
but if they are believing in some system, we tell them to continue their practice. That's only.
Parvatheedevy ji,
Correct,
let me,
Samita.
I just want to add here, I think Harish ji is not aware of the religious sensitivities in Kerala, you know, and what you phrased it nicely by saying in an institutional setting where there are some sensitivities, some of the fine details that are described in Charak and other texts might not be acceptable by everybody. I think I'm being a little more blunt in explaining this. Correct me if I'm wrong.
No, that's fine, Dr. Madanji, but the point is, because I think to manage the Down syndrome completely, Charak has mentioned Devapashra Chikitsa for Karmaj Vyadhi. The role of mantras, Manidharan, even this, what we call Prashchit, Upvas, all these practices, if we can think of and if we can incorporate, I think we can get better results. This is because I have never dealt with any patient of Down syndrome, but this is my assumption that because when I was a student, I learned, and there was a question in my mind: what is the role of Devapashra Chikitsa in Karmaj Vyadhis? Can we work on it? Because genetic disorders, otherwise it is very difficult to manage. But this is my understanding. All right. Thank you very much. Thank you.
Hey, Harish ji, I think your point is well noted about Karmaj Vyadhi. And I think there may be, I don't know if Parvatheedevy wants to add on this, whether you have some experience there, because you see a lot of patients who have.
In almost all psychiatric disorders, psychological issues, their first choice is Vipassana Chikitsa, or they first go to see an astrologer or some religious practitioners, and they are, after doing some Vipassana Chikitsa and after doing or after undergoing modern medication, they are coming. Only their third choice is Ayurveda. Most of the patients, more than 70% of the patients, their third choice is Ayurveda. First, they usually they go for or they consult a religious practitioner. Almost all the patients, or more than 70% of the patients, consult some religious practitioners. Then only they are coming to our hospital. If they these type of astrologer or some religious practitioners, they used to tell that after doing these practices, you go for the treatment, and they are believing that with this treatment they will get relief. So they are believing the treatment and they're doing the treatment, and it's there will be a positive result in that. Some belief is good, but I told, as the institution, we cannot do the Vipassana Chikitsa, but they are doing that. Let it be. Let them continue that. That's all.
Harish ji, I don't know if that satisfies your. Maybe you can also tell us a little bit of how you would approach this problem.
No, actually, if it is a social problem, that is a different matter. The point is, as we discuss Samhita's modern science on this platform combinedly, so whatever I am talking, it is mentioned in Samhitas that Devapashra Chikitsa is part of Ayurveda, and how to incorporate it in the management, like we are doing Sanshodhan Chikitsa with Vastikaram and Sanshaman Chikitsa with various herbs, single herbs, multi-herbs preparation and compound preparations. And even the management with the diet and yoga lifestyles, that is all Sanshodhan and Sanshaman Chikitsa. The point is how we can incorporate Vyapashara Chikitsa, not all the, like we can experiment it with simple procedures. There are many procedures for Vyapashara Chikitsa, including the stone wearing, Manidharan, and the Prashchit, and the Upvas, and mantra. According to their religion, they can do mantra. Like how we can incorporate whether it is useful or not, or can it be experimented? Can it be experimented? Can we do any experiment along with all the therapies? This is my suggestion on the question.
Your question is valid. I don't know if Kamini ji or Agnihotri ji would like to just touch on this point. I don't know, Kamini ji.
Yeah, sir. He's rightly saying that it is very much important, the Vipassana Chikitsa in these cases.
But how to implement this in contemporary setting is it? So the question, I think what Harish ji is trying to tell us, how to interface it with modern science or modern practice. Is that correct, Harish ji?
Yeah, we can do, because many researches are being done in AIMS also regarding this Vipassana Chikitsa in different disorders. They are doing in AIMS Delhi. So why not we? We can also do.
Okay.
Yeah, they are doing Om chanting and they are seeing effect upon patients. So this is also Vipassana Chikitsa, one example. So in that way we can also do. And we are doing in practice in females also. But in kids also, that's why I was asking, what about music therapy? Which types of music, spiritual music, or what type of music is having effect? So if we see that research upon Om is very well documented, that Omkar is giving this much changes in the body, in patients of anxiety, in the patients of depression, in the patients of infertility, in PCOS, we are having many documentation of Omkar only. So other therapies also can have result upon these cases.
Here in Kamini ji, here in the UK, our rheumatologist in London at the Central Middlesex Hospital, they are also getting amazing results from chanting, pain relief,
Yes, sir.
In patients with, I don't know, Harish ji, if that is pointing you in the right direction. Are we thinking in the right way now?
Yes, sir.
Yeah.
We need to incorporate one or two points of Vipassana Chikitsa. Let me give you one example. I have read one article. I will find out the research paper. One clinical trial was done on terminal cases of cancers in US. And in one group, they suggested that just ask your relative to do prayers for you. And other people were given chemotherapy, surgery, and whatever the protocols are, surgery, chemo and radiation, whatever. And the second group was where the relatives were asked to do prayers, and they found the second group, there were good results in second group, where the prayers were done by the relatives. So
for Parvatheedevy ji, who is new to our platform, I just want to introduce Harish ji. Harish ji is joining us from Toronto in Canada. He studied Ayurveda in Punjab, and he was the top student he was the gold medalist for Punjab University at that time when he was studying. And he runs a very successful practice. Sitting in Toronto, he has patients in Delhi. So he manages a very large center in Delhi. And he has a lot of experience with IBS and a lot of GI tract problems, which are autoimmune conditions. And he has, I think he has a case series of, he says about 20,000 patients or more on ulcerative colitis. So very, very good response he has. So that is Harish ji. I don't know whether Harish ji is aware of Kamini ji in AIMS Delhi. I don't know whether maybe there is an opportunity to interact with Toronto. Harish ji networks a lot with the Toronto Health Service. And there is a desire in Toronto to bring Ayurveda into the hospitals in Toronto. And Harishji connects a lot with the government in Toronto, and we are discussing many projects. So he's asking these questions a little bit from the Canadian side, how to take something that will be useful in other parts of the world. I would like to invite Agnihotri ji just to comment on these things, because Agnihotri ji is our senior member of the group, former professor of Swastavrit in Uttarakhand Ayurveda University, and a former student of Banaras Hindu University. Agnihotri ji, this issue about the Deva Vyapasa Chikitsa and Mantra Chikitsa and all these things, please tell us a little more about how we can refine it for the 21st century, refine it for new parts of the world, new societies. Is there something there that we can learn from what Charak is pointing to? Charak is only pointing in one direction. Charak is not prescribing. Charak is only saying, look in this direction, there you will find some useful answers.
Thank you, Professor Madanji. Namaskar. I was listening very interestingly the comments made by Madam Kamini Dhiman and Dr. Harish Sharma. They are really having a good sight over the other allied supportive therapies on those kids suffering from Down syndrome, or those parents who are having such kids, because the parents' mental status is also supposed to be taken care of. So in that way, use of stone, gem, etc., is really very important under the heading of Deva Vyapasa Chikitsa, or meeting towards the Sattva Vijay concept. Naturally, because the kid is say right from 2 years to 12 years or so. So that depends on how much we can motivate him or her to use or go for the rings or the tabiz, ganda, or the some necklace type, something locket type, something around the neck. But the parents can be very easily be motivated if any astrologer properly guides that this progeny was born in under such grace influence, so this is going towards right side, or this is some reverse bakri chal also. So for the slow down the effect of that conjugation of grahas in particular year or particular month, that can be managed. So it's a good astrologer can do better. But definitely, and far as Kamini ji was also talking in the same way, that meditation, dhyan, or something of the month chanting. Professor Madan sir, you might be remembering the talk between Professor N.P. Dubey sir. He has got a wonderful work over the Om chanting and Om recitation, that too in USA. So he has got even a university level work. So, but at the same time, blowing of Shankha itself, that is important. If one is capable, say 6 years kid, blowing of Shankha itself gives the reflex over all the chakras. So the stimulation of chakras on pertaining or leading towards the nervous system. As Madam, our first speaker, Renu Madam was talking about, that Ayurveda can do miracles, Ayurveda can do magic. So goes the case. And what our saints and sages were doing, they were going for the tapasya, they were blowing the shankh and all that. So this may also be highly think about this fact that blowing of this conch may also be of great use. So stone therapy, mantra therapy, dhyan therapy, these are all very much supportive to the health and well-being of the mankind. May it be of in concordance or in the say cooperation of Ayurvedic pathy or spiritual pathy, whatever you can give the term, but effect is here. But as far as the evidence base is concerned or database is concerned, it is yet to be collected. One can go on experimenting and can have a small modules can go, but how much parents will come forward and be motivated for their kids to be allowed with these sort of applications, if at all. If it happens, it will not be of any harm, along with other therapy, other oral or external use of the certain medicine which has been discussed today's speakers stuff. So that can be done. It is a positive effect. It can be achieved. So thank you.
Agnihotri, thank you so much for elaborating. I think what is coming through, what you are saying is that this is an area where we need more, a little more work, and we can do that work.
Yeah.
There are some interventions which we can start.
Yeah.
I think that
Yes,
is
sir.
consistent with what Harishji is saying. Why
Sure.
don't we look at some special design some studies? And I think Kaminiji is here. She's already agreeing that there are studies going on in New Delhi in All India Institute of Ayurveda. So I think we are talking about the same thing, Harishji, that we need a little more collaborative work here, that we need to come together here, Harishji. Because at the end of the day, what Agnihotri mentioned is very interesting, that get the children to blow the conch, for instance, shank blowing for the children, and it will activate certain muscles, and that will activate something else, etc. This is in terms of our current understanding of neurobiology, but there may be some other aspects also. Sound itself can create some changes in the neurological aspects of so many aspects of the architecture of the brain. No, Agnihotri, thank you for highlighting this point, that we need to come together. Maybe these are the future aspects that will come out of Ayurveda, because we have this richness in the Samhitas, and we'll be able to collect things and start some new studies. And I think with Kaminiji here from Sartavihar, from All India Institute of Ayurveda, I think
today she is in Dubai.
Yes, and Dubai ji from, yes.
She is communicating from Dubai today.
Oh, yeah, I know. She says she's coming to us from Dubai. So look at this international connections. So Pavanji, I want to thank
Dr. Harish Sharma is just going to say something.
Harish ji, please.
वो मैं ये कह रहा था सर कि जो वेबिनार की शुरुआत है डॉक्टर पवन जी करते हैं, ये एक आराधना से करते हैं, ये भी देव पाशा चिकित्सा का ही पार्ट है.
बिल्कुल बिल्कुल जी. शुरुआत ही we start with some. यहाँ पे Harish ji, your comment, I just want to add to this. यहाँ पे there are many schools that are run by the Maharishi group, अब इन स्कूलों में क्या है, सुबह शुरुआत 10 मिनट शांत, और शाम को स्कूल के बाद घर जाने से पहले 10 मिनट शांत. अब खाली दो चीज जी अग्निहोत्री जी, खाली दो चीज, सुबह 10 मिनट पढ़ाई की शुरुआत, और शाम को 10 मिनट घर जाने से पहले. अब खाली वो कहते हैं कि खाली just doing 2 procedures, 10 मिनट का silence, that improves performance. अब I didn't believe this जी. I will send you a website. यहाँ European community say they were looking at low performing schools. So a little bit connected to our area, but not too much in the pathology side. For some social reason, there are some schools where the performance is poor. In Portugal, Algarve, in the south of Portugal, the Maharishi group went there and they took one of these schools, and the headmaster is a Portuguese man. He has no idea about Indian systems, kuch bhi nahi. But he said, let me try this because I have the responsibility of the school and I have to improve the performance of the school. Is school mein, at that time, the headmaster was so troubled because the students came from disrupted families, a lot of violence in the family, etc., etc. And he said, do whatever you want. If it works, well and good. If it doesn't matter. Just do it. He was at the closing seminar of the European Community Grant. The name is Friends, the program. I will send you the link on the chat box. This man was crying on the closing ceremony. He says, I didn't believe this. I don't know what it is. But just doing this practice, calmness of the mind, for 10 minutes beginning and 10 minutes end of the class, the children became calm. Before that, the teachers didn't want to come to school because they didn't want to handle these children. And he says, everything just changed like magic. So Harish ji ki baat is completely correct.
Sir, this is the seconding of our everlasting concept of going for the chanting of Shanti part.
Shanti.
We start
Sir,
with and we close. The closing
now,
of Shanti part itself gives the same message that whatever the vibrations we did, we spoke, we drummed, and whatever the sound we made, after all, is Aushadhya Shanti, Banaspatya Shanti. What is that? Now they all cool down and help us. Shanti part itself is the same. So goes the case with the Shanti Kunj Nad Yoga. At exactly 5:50 or 6 to 6:15, they keep mum. No sound, no vehicle, no entries. All gets daily basis. This is on daily basis work. So Shanti parts itself carries the same importance, which is being taken another. Even in our Ladnu, I think in Ladnu, Jain Vishwa Bharati, they used to go for the morning Arihantaram, the prayer, and also at the time of the closing of the offices. This is a good practice, and it gives a lot of great peace of mind to each and everybody who is performing so or who is attending it. So it's a really great concept.
Agnihotri ji, I have put in the chat box a Friends program. The Friends is a short form for fostering resilience, inclusive education and non-discrimination in schools. Ab unka website bhi hai. I'm just putting this here. So thank you, Harish ji, thank you so much for asking this question and giving us a chance to discuss this. And that has refreshed some memories to just put some ideas here. यहाँ पे दूसरी चीज जी यहाँ European community के funding वहाँ से they have given money for this program. Is one teenage yoga, बच्चों में yoga, that is also connected with our discussion today about yoga. Our Renu ji mentioned some very interesting asanas that can be done to improve the aspects of vocabulary and speech in these children. My one question I wanted to ask Renu ji was about the Vedan karma and how it is being administered. How did that thinking come in the Maharashtra tradition, the Vedan karma, to use the little needle to activate certain parts of it? I want to thank once again Pavanji for this wonderful, two speakers only today, but very, very rich discussion, Pavanji. So thank you very much. And thank you, Parvatheedevy ji. Namaskaram. Always a delight to have such a senior and seasoned clinician here with us. And as Pavanji said, you spoke even without any slides or anything, but we were listening very, very carefully to your words. And we want to thank you for us, but we look forward to your guidance.
Also, sir. Dr. M. Prasad has introduced me with Parvati ji.
Acha ji, Prasad ji. So,
Dr. Prasad ji, I am grateful to Dr. Prasad ji.
Prasad ji is important for all of us. So, number one, we look forward to all you senior people because Parvatheedevy ji comes to Germany. We meet many times in Germany. She comes to about, I think her daughter is living in Germany too, somewhere, I think. So she comes frequently to Europe. But we are now creating a new network, Parvatheedevy ji. You know, we want to bring this message to other parts of the world. We want to connect with people who have heard about Ayurveda, but don't know what it is. They don't realize it is so sophisticated. There are so many details, subtle and sophisticated. And we have senior people like Harish ji here, Agnihotri ji, and we are connecting many parts of India. We are connecting many talented, seasoned, experienced people like yourselves. And Kamini ji, for instance, connecting institutions. So we want to keep this journey going, but we need your blessings and guidance. So Pavanji is our anchor man. He will connect all of us. He will bring when the time is right, he will bring us all together again in many, many platforms, like on the 2nd of April. So he has put together our next webinar, 341st webinar, which is tomorrow, same time, 6 p.m. All our webinars are archived, recorded and archived on the website. So for people who are not able to join, they can view our recordings, including everything is archived in our website. And the amount of work that is there, 341 webinars with a lot of detailed content, a lot of information is there. I hope somebody will find the energy to curate this now. People are saying you have a lot of information. We don't know how to go into this mountain of information that Pavanji has put here together, but we will find a way. We will find a way to help. But most of all, we want senior people like yourselves to guide us and grow this further and to take it to a global level, not only national level, at a global level. And it's a big family. Agnihotri ji is there from Uttarakhand. Harish ji sitting in Toronto connects with us almost every day. Doma ji is here from Telangana, and Jayesh ji is there in Calcutta. So it's a big family, and welcome to the family, and welcome to our activities. And we look forward to your guidance, inspiration, strength, for whatever that we want to do as we grow this event further. Pavanji, I hope I have said the right things here.
Thank you. Excellent moderation, sir.
Thank you. Thank you.
I have to learn much more from you, sir. I have to learn.
Thank you.
Thank you, speakers. Thank you, guardians.
Namaste.
Namaskar. One sad news is there today. We have lost our Ayurvedic expert, very senior Ayurvedic expert, Dr. S.N. Ojha ji. He was from Sangli and very renowned dignitary. So in the last, if you kindly permit, we would make, as we were discussing about Maun, so we will be following 1 minute Maun and in his memory as a condolence, and then we will disperse. Am I wrong, sir? Agnihotri ji? Agnihotri ji.
Yes. Let me submit our marks, then
Please.
we will observe the silence.
Yes, definitely, sir.
Please.
Sure. Thank you, Samarian. Thank you, our big dignitaries. We have got only one son, and it comes daily. It is the same, but that son comes with newer ideas, newer expectations, newer desires, newer informations, and newer possibilities. So goes the case with our webinar, as we are stepping day by day, and we reach to 340th. The sun is the same. The Pavansar is the same. Our speakers ornament the whole of the stuff in such a way that even an interested or uninterested person becomes the fan of this webinar. So, paying our regards and respect to Professor Madan sir, Professor Doma ji, Ved Jayesh Thakkar ji, Dr. Harish Sharma ji, Professor Bishnu Prasad Sharma ji from Himachal Pradesh today, and Dr. Kamini Dhiman, Ved Rajan Patankar ji, and all, of course, Mr. M. Prasad sir, along with our great speakers who made today's occasion wonderful. Dr. Renu Rathi, really, she put forward a very good information along with some chaos that why it is happening. Though it is a congenital abnormality which nobody can correct, but with the efforts of the any pathy or pathies simultaneously make some betterment in the quality of life of the person who is suffering from, or the families who is attending this type of the Down syndrome persons. what she put under importance is one of the reason is the delayed pregnancy. So here we have got two things. Either the couples are to be made aware and counseled for having earliest pregnancy, or even the would-be parents, I mean the would-be couple, means those who are going to get married, they are convinced that earning money is one thing, getting promotions at another thing. But if they are having the plan of family, they should also fulfill the desires of parents timely and go for the progeny timely. Because what is infection, especially in our Bollywood, we are all aware of the fact. There's our this Saroz, who got this quadlets or triplets. They are planning at the older stages, and which was not in fashion way back in 30 years or 25 years, but still persons are having one of the their kid as some having some Down syndrome type symptoms. We are well known with our one of the doctor's family. The father is say pediatrician. The mother is also gynecologist, but one of her daughter is having such type problem, and they both are managing their government services very well, hospital duties very well, but at the same time they are paying full attention because of this short of the especially say build person. So this is a very crisis of our society. Number of medicines are given by her, and management and role of Ayurveda is also been put forward, especially all the sanskaras if they are done. And as far as the sanskara is concerned, as we are starting our daily webinar with a recitation and remembering the God, offering our prayer to God. So every family, every person is voluntarily by their own efforts can see, and as much as possible. We are not all following the Sadvrat and Swastvrat of Ayurveda, but 70%, 80%, whatever is feasible to follow, we are doing. So was the case with the such targeted persons. If they do, we can have a better results. And our all immunomodulator preparations, our rasayan, all are there if it is palatable to the age of that Down syndrome suffering patient. So goes the case with our Parvatheedevy ma'am. She also put forward all the possibilities, all the etiological factors, and also talked about the crisis of the family, what may be the role of Matravasti, Panchkarma or Puru Panchkarma. Everything was underlined. Theory is very much clear, but see how difficult to face such person in family and to manage properly when he or she is not capable to manage even the daily routine activities by his or her own. So it's a very important word. So all the time the parents are also to be given full sympathy, full support, full support of the society. There may be financial crisis, there may be medicinal problem, there may be transportation problem, as she underlined that it is difficult. Parents say that it is difficult to say travel with the public sector vehicle or avail the buses and trains simply because of the staying and all that other families are doing. But after all, our two great speakers, our discussions started with the presence of Dr. Hari Sharma and Dr. Kamini Kaushalji. They put forward with the two things that going for the recitation of mantras and using the gem stones with the support of the upliftment of the mental status in the terms of their Saptavajay or Devapasya Chikitsa. Dev is always there. It is, had it not been of any use, there would not be in any place in our Ayurvedic Sangitas. It is always there. Our Gita, Bhagavad, Sare epics are, they are all giving our support to lifestyle. So today's submission, along with the Down syndrome persons, the kids are to be taken care of at the same time. Persons which are there in their family, these families are to be taken special care with all mental, social support, so that they should feel themselves as a part of our society, not they are supposed to keep aloof, and then this type of uneasiness or agony will rise like a disease. So it is better that we should make a frequent contact with them, with the view that let us see what we can do, though it is a say given by God. So there is no mistake of anybody, neither the parents nor the child itself. So society has got a great support which may better the quality of life to that family itself. So these are my words for today's submission, and thank you all. You have given me the opportunity to communicate my views. Thank you so much.
Excellent as usual, sir. As regular, excellent, great. So now, kindly guide me, Madan ji, to
We will stand all now at our place, and we will observe 1 minute silence in the respect of our Oja sir.
तो इसकी आप लीड लीजिए सर.
Yes, we have just told you. Yes. Oh. Om Shanti.
Om Shanti.
Om Shanti. I've got this information in our Ayush Ayurveda by Dr. Professor Anil Shukla ji from Bhopal. I was thinking that I may share this thing, but by that time our webinar started. So he was a very revered person and having a great support. Anil wrote that he was a great appreciator of the Shero Shairi. Talked about Anil Shukla and all that. So we miss all
Jayesh ji, Dr. Jayesh Thakkar ji. Dr. Jayesh Thakkar.
Yes,
Please brief कि वो अपने प्लेटफॉर्म पे भी आए थे. Please.
Yes, sir. Dr. S.N. Oja sir, as a student, I used to follow his regular posts in Facebook media and social posts. He would regularly update the different cardiac cases, how he handles with the Nidan, Samprapti, and it's interesting. I think the archive is also available in his Facebook account, and there have been a publication of his notes in PDF, which is being circulated in many WhatsApp groups. And it was on 29th September when we had a lifestyle disorder series on holistic heart care, when sir was looking for one of the best person to speak, and Dr. S.N. Oja sir was one of the first in my mind. And sir was kind enough, despite his busy schedule, to grace the occasion. It was just 5 months back we had him, and the records are also available. We pray for the greatness of the soul. Prayer for the soul. Om Shanti.
वैद्य राजन पटनकर जी महाराष्ट्र से हैं. तो वैद्य राजन पटनकर जी, क्या आप ओझा जी के विषय में कुछ बोलेंगे?
उनको एक ही बार मिला था, ज्यादा उनसे मुलाकात नहीं हुई थी, पर बहुत ही जैसा कि अभी जय जी ने कहा कि उनका अप्रोच जो रहता था हर एक पेशेंट के बारे में, वो दैट वाज रियली रिमार्केबल. मतलब उनको अगर हम सब लोग फॉलो करने लगेंगे तो हम लोग अपने ज्ञान से भी बहुत आगे बढ़ सकते हैं. तो उनको मेरी तरफ से भी श्रद्धांजलि. ओम शांति शांति शांति.
पवन जी, मेरा भी थोड़ा इंटरेक्शन हुआ है डॉक्टर ओझा जी के साथ, एंड आई फाउंड हिम ही वाज अ ग्रेट साइंटिस्ट ऑफ आयुर्वेदा. साइंटिस्ट मैं इसलिए कहना चाहता हूँ, उनको मॉडर्न मेडिसिन की नॉलेज बहुत थी और मॉडर्न मेडिसिन के साथ जो आयुर्वेदा के जो सिद्धांत थे उनका जो कंपैरिजन वो करते थे वो बहुत कमाल था। उन्होंने कई जो एंजाइम्स हैं, जो लेटेस्ट एंजाइम्स हैं कार्डियोलॉजी में, जैसे ट्रोपोनिन वगैरह वगैरह, उसका उन्होंने कई बार, 2-3 बार मेरे साथ बातचीत हुई तो उन्होंने बताया कि देखिए आप इस पित्त को देखिए, इस वात को देखिए, मतलब वो वात पित्त का आपका कोरिलेशन बहुत अच्छे तरीके से मॉडर्न बायोकेमिस्ट्री और मॉडर्न फिजियोलॉजी और मॉडर्न पैथोलॉजी के साथ करते थे। और मैं आज पहले तो आज श्रद्धांजलि देता हूँ और भगवान से प्रार्थना करते हैं कि उनकी आत्मा को शांति दे। और आज मुझे लगता है कि इट वाज ए ग्रेट लॉस टू आयुर्वेदा एंड आयुर्वेदिक फ्रेटर्निटी। ओम शांति, ओम शांति।